Hi, my name is Shannon Rowe. I am with the doctorate program at Indiana State in athletic training. And today I'm going to be talking to a good friend of mine, Ashley, not Wells anymore. It is, what's your last name now? What is it?
Gabriel.
Gabriel.
Gabriel?
Ashley Gabriel. And we're going to be just talking about athletic training in the emerging settings. So, first of all, Ashley, give us a little background of you and um, how you got to where you are right now.
How I got to the clinic setting?
Yes.
So I first graduated from a program, of course, and then I worked at the high school level. And then my husband, boyfriend at the time, was transferring over to Monterey County. So I was looking at places in San Jose, even San Luis Obispo, even was it San Luis Obispo and Paso Robles. And then I came across the outpatient program in Monterey City. So.
Cool. All right. So, just tell me about what your job, like what your duties are in an outpatient, and kind of also, if you could, describe what your clinic is like.
Okay. So it started as a brand new program when I first began. It was February, and I was hired I started that July. We first started in a very small clinic where it was tiny, where there was 2 tables, 2 mats, and dumbbells, and exercise balls, and that's it. So we started there, and then we just transitioned to a bigger place where we actually have a CrossFit cage. It's called what is it? It is muscular. It's a squat, back, and triple cable cars, or cable crosses. But what it does is it's video. You can play video games as you're exercising.
Okay.
So it's like ah, it's exited my mind. But yeah, I can't think of it. We use it all the time, and I can't think of it. But the rehabilitation system. And then we have another set of cross cables, kettlebells, and more dumbbells. We have now 3 treatment tables. We have the traditional ultrasound e-stem, but now we also have called a class 4 laser.
Mm-hmm.
So we have all these great things now, and my responsibility is basically acting as a physical therapist, but under a doctor. So I do their treatment plans. I build their treatment plans. I build their rehab. I talk with doctors to see how they're progressing, and if they're clear to go back to work, because we have a lot of workman's comp, or if surgery would benefit them, or if additional physical therapy, or I've requested aquatic therapy for some patients. So we have a lot of responsibilities like a physical therapist, except we get the advantage of we're under a doctor.
Yeah.
So
Right. That's awesome. So, as working as an athletic trainer, how would you say it differs from, besides working, like you said, under a physician, how else do you see yourself differ from a PT?
we're a little bit more hands-on, and I notice because we do have a DPT now, and I notice we're I shouldn't say a lot more aggressive, and we progress them a lot faster, and we we look. So say I'll give you an example. Say they have a shoulder injury, and the traditional internal external shoulder ring exercises, empty cans, full cans. But what we also do is we look at their posture, because posture plays a huge role in their rehab. And if
Right.
they have bad posture, like say forward head posture,
Yeah.
then we give them exercises to help with their neck, the neck extensors, their neck range of motion, and with the shoulder as well. And
Yeah.
we've had where insurance companies have actually, we've justified, say they wanted traction, but it was for their shoulder. We've actually justified why they need a traction machine for their shoulder injury. So,
That's cool.
yeah.
And does the DPT, are they don't really work throughout the kinetic chain, or do you feel like maybe, I don't know, that they're more focused on the primary injury itself, or do you feel like they're also working aggressively, or because you said that you guys work way more aggressive?
Yeah, because we want them. Our goal is they get, for workman's comp and even primary care and even TRICARE, they get 12 visits.
Mm-hmm.
So our goal is 12 visits. We are going to push you until 12 visits.
Yeah.
We're not going to cause more harm, because we all listen and we all know pain tolerance, but we're going to act like 12 visits is the last time we're going to see you.
Yeah.
So, and by the 12th visit during our reevaluation, if they don't improve, then we're going to request and we're going to justify in our notes that additional physical therapy is going to benefit them.
Mm-hmm.
So, and usually we get it, but with PPO, it's easier to get it. Workman's comp, it's a lot. You have to really word and justify why you want them to have certain things. So
right. Okay, so that kind of actually leads into my next question of insurance and being able, like, are you, like, so you're in a clinic, how are you able to bill, I guess? How are you able to do that being athletic trainers? And I don't know, I mean, athletic trainers isn't even considered a profession in California. So how are you working this? Or
we bill under the doctor.
okay.
So he'll write us a prescription and we follow the prescription and he signs it off basically. Okay. So, and then if we need, like, we do a lot of manual therapy. We do a lot of soft tissue mobilization, a lot of ART, a lot of scar tissue. So say they just have exercises, diagnose, evaluate accordingly, and exercises, and then ease them. But we think they would benefit with laser. Then we just tell the doctor, and they'll prescribe it, and then we'll go through the insurance company, and then with workman's comp or PPO, and then they'll pay for it.
So it sounds like you guys have a really good relationship with your physician then, if he's able to, you can kind of just, hey, we think this is really beneficial. So that's really awesome. That was another question of mine. Go ahead.
We have two physicians. So it took us some time to build have that confidence in us, but both of them saw how their patients were progressing, and that they were not needing, some of them, not all of them, because you always have those patients, but some of them, they don't need medication anymore.
Yeah.
And that's a huge thing. Huge.
So prescriptions, if you can decrease prescription medications, and that's seen very highly in the physician world. Cool.
Yeah.
So that kind of also led to my other question. You're doing great at this. With working with physicians, like, you're able to, I guess, like, I was not exactly nervous, but I was just curious to seeing how it worked with being with physicians. When you're not in a clinic, you're not working with a physician, you're not seeing them as frequently as if you were working in a hospital, or having a physician come to campus for like doc nights on campus at a college or anything like that. So how did you reach out to these physicians? How did you, like, get that confidence that you were talking about before to build that relationship between the two healthcare professionals?
Honestly, it took patience. Not like patience like time. It took for the patients to see, because with workman's comp, they do, say, 4 weeks they have a follow-up, or 6 weeks they have a follow-up. follow-up, but we still have them for PT. So when they would reevaluate and touch base with those patients, they saw the improvements, even if it was a very small improvement. Like, say their range of motion they didn't have any range of motion. So say they had like 70 degrees of range of motion in flexion and shoulder abduction. And then after half of the visit, so after 6 visits, when they have their follow-up again, they're at 90. And having that, even though it's not completely within normal limits, seeing that small improvement, I feel like helped build the confidence. Yeah. Then we'd be so close, because now we're in another office, but they used to be down the hall. So we had a question, or we wanted to look up an x-ray or an MRI, and we couldn't on our computer. Me and my colleague Mark would just go, when we had time, go in the hall. And just, I mean, it's just one of those things you have to do it. You have to talk to them. Yeah. You have to just be assertive. Like, what my boss told me, just fake it to make it. Have that personality, like, you kind of own it, and even if you feel like you don't, just, your stuff. You got to do it. Yeah. So.
And I'm sure, I know that you're great at that. Like, you're so great at, like, having that confidence of, like, all right, this is what's going to happen. So, like, that's awesome, like, that, I mean, obviously, I think it's important for clinicians to know that, you do have to put yourself out there. You do have to get in those uncomfortable situations, but in the long run, it'll turn out well.
Yeah. I'm surprised. I used to be nervous going back there, because one of them is, like, straight laced, serious face, like, straight sarcastic. And I didn't know this when I first, how to talk to him. Mm-hmm. When I went back there, and I asked a question about a patient's MRI, and because it wasn't in the system, and I wanted to look at the images, he just, who are you? And I've been there for 3 weeks, and I'm looking at him, and he's just, what do you want? Why do you want the MRI? I'm like, and he's just, just kidding. Here you go. Go ahead. And then he goes into the patient room, and I'm like,
oh, man. All right. So let's go into some next set of questions of kind of just the profession of athletic training. So now that you're in this untraditional emerging setting is what we're calling it. So you're in an outpatient setting, and that's kind of a next step for athletic trainers. Where do you see it going? How do you see it progressing or not progressing? Maybe you don't see it going well, or I don't know. Expand your thoughts on that.
I think it's going to take time. So just because we've had to educate our doctors and our PA, and I mean, not butt heads, but we struggle to educate our nurse practitioner on our talents, on our skills. And I think the nurse practitioner, it took her some time, because she only saw us as personal trainers. And that would be so frustrating. Yeah. But it's one of those, it's education. Like, I volunteer at, not volunteer, but I've been volunteering at 5Ks and 10Ks. And I've been educating, because it's not very known. In Fresno, it's completely different. Yeah. People know what an athletic trainer is, right, and what an athletic trainer does, and they respect it. Here, it's a struggle. But you have to go out there to educate them. If you want to stay here for a while, you have to go volunteer and just, even if it's just handing cups of water, letting them know at the finish line, I'm an athletic trainer. I can assess emergency situations. I'm first aid. If you need me, let me know. Mm-hmm. And that helps. It's educating them. That's a struggle, and you have to stick up for your profession. Yeah. You have to be aggressive, and you have to say, when they say personal trainer, you correct them. You're nice about it, but you say, no, I'm an athletic trainer, Yeah. I'm honest with my patients, because they think I'm a physical therapist, and I have to correct them and say, I'm an athletic trainer, and well, what's the difference? So I have to explain, what an athletic trainer does. Right. So, but yeah, a lot of the patients, my physical therapist. No. Athletic trainer. Athletic trainer.
Good. I'm glad you're sticking up. Yeah. So what do you tell patients? What do you tell patients the difference? Like the main like in a layman's term, like you're literally talking to a patient, you're not gonna say like, oh, we do you're not gonna, go into the whole spiel about it, but like if you were to give it two sentences of, all right, this is an athletic trainer compared to a PT, what do you usually say?
Compared to a PT.
What's the difference? What do you tell patients in layman's terms?
In layman's terms?
Yeah.
In two sentences.
Or you can as many sentences as you want.
Okay. So I tell them, the tradition, what I've always told them, that you're watching a game, okay? You're watching a basketball game, a football game, and you see a player goes down. I'm the one that runs on the field, and we're the ones that do the assessment with the doctor. We work with the doctor to get them off the field. Now at that time, that Monday, they're in getting treatments, rehab, and they're getting cared for just like you. Except I didn't pick you up from the field. I didn't bring you in. So I'm the one that's going to make you get better to go back to work. I'm the one that's going to make you better to go back to active daily living, but at a better level. That's how I tell them. I tell them I'm more functioning rather than active daily living. Because I've told patients, a physical therapist is going to teach you how to grab a cup, but I'm going to teach you how to grab a cup with using your scapula with more downward rotation, less trap activation to push on that nerve, and I'm going to get you strong so when you grab the cup and it's awkward, you're going to have the reaction to hold it.
Dang.
I know.
Yeah, I mean that makes perfect sense, I think, for anybody to understand of, because I mean everyone watches those sporting events. I think that's what people know us the most for, is like, oh, like we see someone run onto a field, but it's more of like, okay, but it's not like that's just like a small fraction of what we do, but like there's so much more that goes around it, so that's cool.
Yeah, I just get them back quicker.
Yeah.
And I tell them I work with athletes and I work with people who perform at a higher level. So I'm going to get you back quicker and faster and as better conditioning and as better strength as I can before you leave.
Do you feel like because your patients know, like when your patients know that they feel like they're getting like all-star treatment, like, oh, she's worked with athletes, so that means that I'm getting like better treatment?
Yeah.
Like, yeah, I mean, a joint mob is going to be a joint mob regardless of who it's from, but
yeah, because I had one patient that has bad knees, but now she's having shin splints. So, and then I part-time work at the junior college here. Okay. And when I had her, I did my research on me and my colleague at the junior college had done research and discussions about shin splints. So when I sat down with her, when I got her as a treatment or for physical therapy, I sat down with her and she's telling me about her shin splints. And I was like, oh, I'll do light therapy and I'll tape your arches just like I do with the Hartnell athletes that do cross country. I was like, I deal with this all the time. And she lit up. She's like, oh, thank goodness. And she was getting slowly better. Yeah. So she has other problems, but that's a whole nother. But her symptoms were her pain was slowly decreasing.
That's awesome.
So, but they love, because we work a lot with kinesio tape, and they love kinesio tape, and we do a lot. Surprisingly, we do. Well, I shouldn't say surprising. McConnell tape. Yeah. With the Luca tape, and people are shocked on how when they squat better and it's pain free, and it's like, well, your patella is laterally tracking, so yeah. That's where we benefit over our physical therapists, is that we know all these tape procedures, and they're comfortable with it, and they're able to do their exercises, and then they take it with them and they come back and we redo it until they get stronger. Right. So we have that advantage. I've noticed that.
Nice. Well, I think that's all that I got right now, but thank you so much for talking to me, and I wish the best for you, and I can't wait to see you.
I know. It's been forever.
I know. Let me try to figure out how to exit out.